Hello, and welcome to the Alabama Public Health Training Network. I'm Brandon Vaughn with the Alabama Department of Public Health. Thank you for joining us today for our program, EPSDT Care Coordination Protocol Training. If you have a question about anything being discussed today, please call or email during our broadcast. The phone number and email address are on your screen now and will appear again later in the program. Also, the handouts and evaluation are available online. You'll need to register for this program in order to access those materials. Continuing education credits are not available for this program. Before we get started, I would like to introduce our presenter today, Carolyn Miller, Social Work Director for Family Health Services. Welcome, Carolyn. I know you have a lot of important information to cover today, so let's go ahead and get started with your presentation.
Thank you, Brandon, and good morning, everybody. What a way to start our week is to talk about protocol and coding. Glad to see everyone here today. Our objectives for today are to learn about the changes in public health care coordination with the ending of the Patient First program, overview of the EPSDT care coordination services that we will be providing, and the changes in coding and documentation in ACORN for the EPSDT Care Coordination Program. As you all know, today is the last day for Patient First for public health as well as for Medicaid. Public health social workers will continue to provide some of the services that we are currently providing in our Patient First program. However, we will be doing it under EPSDT instead of Patient First. And those services include following children with elevated lead levels, newborns with failed hearing screenings, and newborns who have failed required screenings. This is what we used to call the metabolic referrals, but we've extended that title to newborn screenings because the diagnoses go beyond metabolics. It's become much broader of a category. Let's talk about each of these programs just very briefly to remind ourselves of what we do in these as we go forward and before we talk about the coding that you'll be doing in these services for EPSDT. We'll start with the elevated lead. Referrals are received on children under 21 that are identified with a possible elevated lead level. Usually these children have had one test, whether it's capillary or venous, and we want to get them in for that second test. So what's the purpose of this program? It is to assist families in getting children in for that second test, educating the families on what that source of lead is and the dangers of lead poisoning in their children. Working closely with environmentalists to find that source if possible. If the lead level is 15 or higher, they go out with the care coordinator to find out what that lead source is. And then following up until the lead levels are below 5. The second service that we'll be providing under the EPSDT program is newborn hearing for those children with Medicaid. Referrals are received on newborns that have failed their hearing screenings, and the purpose is to help the family in scheduling a second hearing screening and diagnostic testing, and then making referrals as needed, such as through children's rehab services or early intervention. And then the third category is the newborn screenings, and these are the category that we used to call metabolics, as I said, but now they are going to be called newborn screenings in the EPSDT program. Referrals are received on newborns who have failed their screenings. These are babies that took that blood test in the hospital, and when they come out, these screenings hopefully have passed, but if not, we get those referrals. It's critical that we follow up on these babies as soon as possible because some of these diagnoses are very critical, and if we don't get out there soon, they can become very ill or it could result in death. So the purpose is to locate the families of these newborns as soon as possible, educate parents and caregivers on the importance of retesting and follow-up, and then make the referrals as needed, just like we do for the newborn hearings test. So what are the highlights of what we're going to be doing in this new program? Well, the good thing for you all is that the protocol remains the same. What you're doing with these services in Patient First will remain the same under EPSDT care coordination. So you don't have a whole new protocol to learn. The protocol manual for EPSDT is still being edited and looked at, so until that is sent out to you, you can refer to your patient first protocol for your day-to-day protocol services under each of these three categories. They will require a CHR number, just as they did in patient first, and there's no prior authorization, just like there is no prior authorization under patient first. Some of you who've been here long enough can remember the medically at risk program where we had to have prior auths, but just like patient first, we will not need a prior authorization or a physician's order to see children under these categories. The most significant change is going to be in different service area codes and how you code your time in ACORN, which is the reason for this training today, is to look at that. Here are the service areas and the programs that you will be coding to in ACORN. The program for most of what we're going to discuss today is Medicaid case management. And the service areas under the Medicaid case management will be in those fields for Medicaid patients. That would include lead for Medicaid recipients in that service area 36, newborn hearing, which is 35, and newborn screening. Remember, this is what we used to call metabolics, and it'll be called newborn screening, which is 33. There's another category up here that isn't under Medicaid case management, and that is lead grant. We are now able to get reimbursement through a grant through Family Health Services for our non-Medicaid recipients who have elevated lead, and they will be service area 34. In that program, and you'll see an example of this in a minute, is going to be under our case management initiative. But besides that, the rest of the categories on here, the lead, the newborn hearing, and the newborn screening, which are all for Medicaid recipients, will be under Medicaid case management. The other category is for those non-Medicaid newborn screenings, which is what we used to call metabolics, and we will continue to code that under a program Other in the service area Child Health. So let's look at some examples of what we've got, and I realize I'm going to need my glasses maybe to see this. The first one is for a referral for care coordination. And you can see here that the program is Medicaid case management, and then you continue to fill out the information as needed on there. So this is one of those that's going to be under EPSDT, and it's Medicaid case management. While you're filling this referral for care coordination out, the referring provider will be ADPH Central Office. Thank you very much. That is very helpful. So the referring provider will be ADPH Central Office. If you couldn't see, they moved the screen closer to me. So once again, this is Medicaid case management, and the referring provider will be ADPH Central Office. And we have that today for our LEDs and several other programs that we have. And then you would continue to fill this out as you normally would with the reason for referral, the medical conditions, and all the things that you do today under the Patient First program. Our second example is for the SSR, and we're going to be spending a bit of time on the SSR for this. This is for the care coordination newborn screening. So the service area would be newborn screening, which is 33. The program would be Medicaid case management. And here we've coded the time to the patient and explained at the bottom, just like we always do, what that service was for. You will also have the ability to code DPH time as you need to for this, but of course most of the time you will be coding to the patient. So this is the newborn screening, which used to be our metabolics. which is 34, and Medicaid case management. Our next example is for the CDC-led grant, and this is the one that's a little bit different. So you've got your CDC-led grant up there, which is 34. I'm sorry, the newborn screening was 33. But the lead grant is 34, and if you look at that second arrow, the program is Case Management Initiative. Our third one is for lead screening, which is 36, and because this is for Medicaid patients, that would be, the program would be the Medicaid case management. And then here we have the newborn screening, hearing screenings, and the newborn hearing screening is for service area 35. This is for Medicaid patients, so again, it would be Medicaid case management. I know it's repetitive, but I wanted to give you an example of each since you would have these slides to help you as you are filling out that SSR. And then finally, we have the metabolic, what we used to call metabolic for newborn screenings, but this child does not have Medicaid, and so you would be coding this to service area child health, and the program would be other, which is what you do today, and then continue to code to that patient for what you have. So in summary, Patient First program, as you know, ends at close of business today. You can continue to code to Patient First until 5 o'clock this afternoon, or when you leave the office today. The elevated lead, newborn screening, and newborn hearing screenings will continue under our new EPSDT care coordination program, and you will be coding to that program starting tomorrow, October the 1st. The protocol will remain the same, so there's no changes in that. It's primarily the coding to ACORN and coding on your SSR time. I know this is a brief training, but this is what we wanted to focus on today, was the coding of the program and to your SSR. Do we have any questions? Melissa?
Carolyn, can you put the slide back up that has the SSR listed on it with the newborn hearing? I just wanted to ask a question about if the child appears to be Medicaid eligible, but they don't have the Medicaid's not actually active yet. How would they?
For the newborn hearing?
Yes, for newborn hearing.
How do we do that today? We do that, we don't, I'm saying yes and no. I'm saying yes, we code.
Okay.
Let's go ahead and code to the EPSDT because we can help them on their application process so that if they get on that month, they can be billed to that,
Right.
and if not, it'll be kicked out.
Okay.
Other questions from the audience? We have Bill Kennedy with us who set this up in ACORN. Did you have anything you wanted to add to what we said, or?
No, I think you did a great job. The emails went out right before this program that highlighted the ACORN changes. So you will be able to make changes through the end of the week, which is October 4th, for dates of the 30th and before. So that's still in a play. But as of tomorrow, you will not be able to use any of the family planning or patient first service areas.
Right, and can start coding to this tomorrow.
Correct.
Tomorrow morning. Questions, Brandon?
I do not see that we have any questions as of yet via email. No questions.
Everyone completely understood everything that was said today, and that's great.
It is.
There is a test with this, and this is considered training for the EPSDT program. So if you think you may be working in this program, I know some of you aren't sure what you'll be doing yet, but if you think that's a possibility, go ahead and take the test. Hope it's on coding, so hopefully you can use the slides and look back on that, and that should help you. But you will be required to either watch this, take the test if you are going to be working in this program. Wait another minute or two to make sure that we've answered questions. Of course, you can always email me if you have any questions about the coding or the program. Again, refer to your Patient First protocol for what you're doing right now in these 3 areas, because that's really not going to change. There's going to be an updated protocol sent out to you, mainly just changing the Patient First to EPSDT.
Well, it looks like we still have no questions.
Okay, if we have no questions, I'll let you go about your day, and I hope you have a great week. Don't hesitate to call me or email me if you have any additional questions. Thank you, and have a good week.
This concludes our program for today. I want to thank Carolyn for being here, and thank you for watching. Please remember that you can refer back to the training and the resources anytime on demand. Have a great day.